Hi guys, welcome back to our podcast Bio Buddies. I'm Anavi.
And I'm Ashrita. And today we're here to focus on one of the most underdiagnosed cancers, pancreatic cancer, and how it intersects with diabetes, which we covered in the previous episode.
So part 1, the basics of pancreatic cancer. So let's start off with what pancreatic cancer actually is. So it typically refers to pancreatic ductal adenocarcinoma, and that's the most common type, starting in the cells lining the ducts of the pancreas.
And the pancreas is an organ that has two functions. Firstly, it produces enzymes for digestion as well as hormones like insulin and glucagon to regulate blood sugar control. When cancer develops here, it disrupts both of these functions.
It's often called the silent killer because symptoms like weight loss, jaundice or vague abdominal pain appear late, and by that time it's diagnosed, around 80% of cases are already inoperable.
So moving on to part 2, the connection with diabetes. So let's talk about how pancreatic cancer relates to diabetes. So there's growing evidence that new onset type 2 diabetes, especially in people over 50, can actually be an early symptom of pancreatic cancer.
Exactly. So one theory is that the tumour affects the islet cells in the pancreas, reducing insulin production. And another is that it creates systemic inflammation that causes insulin resistance.
So a 2023 case study by Queen Mary University of London found that around 1% of patients over 50 with new onset diabetes were diagnosed with pancreatic cancer within 3 years. That may sound small, but it's a 10-fold increase in risk.
So let's go over a case study about early detection. So one promising UK initiative is the Dynamic Trial, which is run by the University of Oxford and the NHS. It uses AI algorithms to flag older patients who develop sudden diabetes and unexplained weight loss.
So instead of just treating diabetes, they're sent for early pancreatic imaging, like an MRI or an endoscopic ultrasound. The pilots saw a 30% increase in early-stage pancreatic cancer detection, which is significant when survival rates drop off so sharply with late diagnosis.
In one documented case, a 62-year-old woman with recent onset diabetes and mild jaundice was diagnosed through this system. She received surgery within weeks and is now over a year post-op with no recurrence.
So moving on to part 4, any recent breakthroughs. So let's talk about treatment. One major issue to pancreatic cancer is often resistant to chemo and immunotherapy due to its dense stroma, sort of a biological shield that protects the tumour cells.
But there's been progress. In early 2024, a phase 1 trial at UCL tested a new mRNA vaccine designed to stimulate the patient's immune system against tumour-specific neoantigens. It showed promising immune responses in 50% of patients, which could be a massive game changer.
Another exciting development is targeted radiotherapy, which uses isotope-labeled antibodies, which can deliver radiation straight to pancreatic cancer cells. Trials in Manchester showed tumour shrinkage with few side effects than conventional therapy. So moving on to segment 5, current affairs, a spotlight on awareness and access. Before we wrap up, we need to take a moment to look at what's happening right now in terms of pancreatic cancer awareness and healthcare policy.
So a major current concern is the diagnostic delay in pancreatic cancer. A 2024 report by Pancreatic Cancer UK revealed that over 50% of patients had to visit their GP 3 or more times before being referred for imaging. And that particularly worries us when we know time is critical for survival.
So we found out that in response, the NHS launched a Be Clear on Cancer extension pilot in early 2025, aiming to educate both the public and primary care teams about red flags, including unexplained weight loss, fatigue, and new onset diabetes in older adults. This campaign is currently running in areas like Birmingham, Leeds, and South London.
We're also seeing a push for better equity in access. Data from the Office for Health Improvement and Disparities show that patients from deprived or ethnically diverse communities are more likely to have late-stage diagnoses. And these groups often face barriers to early healthcare access, whether due to GP shortages, language gaps, or even stigma around symptoms.
Interestingly, the Dynamic Trial that we mentioned earlier on is now expanding into more community health hubs in lower-income community areas to close the gap. They're pairing diabetes checks with risk-scoring algorithms to catch suspicious patterns early on.
All of these points to one key message. Research, policy, and technology are beginning to align. But the next challenge is making sure no group is left behind in the process.
So that wraps up today's episode. Pancreatic cancer is complex and devastating, but awareness, innovation, and early recognition, especially in diabetic patients, can shift the outcomes.
Thank you so much for tuning back into Bio Buddies. We hope you enjoyed this episode. If you have any more questions, feel free to ask any of the biology subject fellows or teachers. We'll be happy to help.